Hi guys, welcome back to my channel. This is Mihir from Proprio Junction, and in this video we will be covering the last part of the shoulder complex series, which is the glenohumeral joint. Firstly, I want to show you how glenohumeral joints looks like in a skeleton. So if we go with the name of the joint, which is the glenohumeral, so it should be between the glenoid fossa of your scapula and the humeral head. Now you can see your glenohumeral joint in this skeleton, and the proximal segment of this joint is your glenoid fossa. Proximal means towards the body, and distal segment of this joint is your head of the humerus. So first let's talk about the head of the humerus. So if you see your head of the humerus, it is a ball like structure and it is having a convex surface. And if you see your glenoid fossa, it is having a concave structure. And if you see your head of the humerus, it is bigger than your glenoid fossa. Imagine your glenohumeral joint proximal segment and the distal segment as a golf ball sitting on a golf tee. So a golf ball is the head of the humerus and the golf tee is the glenoid fossa. So now you can appreciate the size of the head of the humerus with respect to your glenoid fossa. Now let's talk about the angulation. So there are two angulations. The first is the angle of inclination and the second one is the angle of torsion. So first let's go with the angle of inclination. So it is an axis through your humeral head with relation to the vertical axis through your humeral shaft. So you know that to make an angle we need two lines. So the first line is through your humeral head and the other one is through your humeral shaft. Okay. So the angle it is making is between 130 to 150 degree in frontal plane. So guys, now let's talk about the angle of torsion. So if I go with the textbook definition, which says it is an axis through your humeral head with relation to the axis through your humeral condyles, and it makes an roughly angle of 30 degree. So again you need two lines to make an angle. So the first line is between your humeral head and the second line is between your humeral condyles. You have two condyles guys, your lateral condyle and your medial condyle of your humerus. So as you can see in this picture, it is from the superior view. First line is between your humeral head and the other line is through your humeral condyles. So it is making a roughly angle of 30 degree. So guys, now let's talk about glenoid labrum. So the glenoid labrum is an accessory component to your glenoid fossa. So it is a fibrocartilage rim across the surface of your glenoid fossa. So it will increase the depth of the glenoid fossa and it will increase the concave curvature of the glenoid fossa so that your head of the humerus lodges into the glenoid fossa. So guys, your entire glenohumeral joint is covered by an joint capsule, and the joint capsule is tight in the superior aspect and loose in the anterior and inferior aspect. So guys, we will talk about four ligaments in the shoulder joint and we will talk about them in detail. So your first ligament is your glenohumeral ligament, second one is your coracohumeral ligament, third one is your transverse humeral ligament, and the fourth one is your coracoacromial ligament. So guys, now let's talk about the ligaments of the shoulder joint in detail. So your first ligament is the glenohumeral ligament. So according to its name, it should be between the glenoid and the head of the humerus. So as you can see in this picture, so your glenohumeral ligament is having three parts. So the first part is the superior glenohumeral ligament, the second one is the middle glenohumeral ligament, and the third one is the inferior glenohumeral ligament. And again your inferior glenohumeral ligament is having three parts. The first one is the anterior band, the axillary pouch, and the posterior band. So guys, the next ligament is the coracohumeral ligament, and before going to the coracohumeral ligament, I want to show you guys how the rotator cuff muscles looks like in a skeleton. So guys, now let's see the rotator cuff muscle in a skeleton. So you know we have four rotator cuff muscles, the supraspinatus, infraspinatus, subscapularis and teres minor. So they all are deeper muscles. So first of all I have to remove the superficial muscles.
3 weeks later.
So guys, I remove all the superficial muscles. So now let's see all our rotator cuff muscles. So this is your infraspinatus, this is your supraspinatus, this is your teres minor, and now if we see from your anterior view, this is your subscapularis. So for now, I want you to focus on the supraspinatus and the subscapularis. So if you see the supraspinatus, so you can see the insertion point of the supraspinatus is the greater tubercle of the humerus. For subscapularis, the insertion point is your let me remove the coraco and bicep brachii. So for your subscapularis, the insertion point is the lesser tubercle. So again, for infraspinatus, it is greater tubercle of the humerus, and for subscapularis, it is your lesser tubercle of the humerus. So guys, now let's talk about the coracohumeral ligament. So the coracohumeral ligament is between your coracoid process of the scapula and the head of the humerus, and it is divided into two bands. The first band arises from the coracoid process and inserts into your greater tubercle with your supraspinatus muscle, and the other band arises same from the coracoid process and inserts into your lesser tubercle with your subscapularis muscle. So guys, the next ligament is the coracoacromial ligament. So it's between your coracoid process of the scapula and the acromion process of your scapula. So with regards to your coracoacromial ligament, we will also talk about the coracoacromial arch. So guys, now let's see the coracoacromial arch. So the arch is formed by your coracoid process of your scapula and the acromion process of your scapula, and in between them there is your coracoacromial ligament. So all these structures make your coracoacromial arch, and the space between your coracoacromial arch and your head of the humerus is known as your subacromial space. Okay guys, so it is known as subacromial space. The job of the coracoacromial arch is to protect the structures present in your subacromial space. The structures like the head of the humerus, the rotator cuff tendons, the long head of the bicep tendon, and your subacromial bursa.